This is RT Action Step 3, bridging. Again, this is something we learn in the foundation training. It will follow on from RT Action Step 2, Vivify Specific. So generally we will always vivify before we bridge, because we want to actually be working with the part that's holding the distress. If we're working with traumatic or difficult material, like a normal client session, we would normally ask the client, what do you want to change today? Or what are you willing to change today? And they'll say, I'm so stressed at work, or whatever's going on in their current life. We will vivify, how do you want to feel? How do you want to act? So then we know at the end of the session if it's worked, if it's resolved, because they'll be feeling more in line with how they want to feel and how they want to act. But to get to early memories, when we're working with fear, anxiety, or rejection, shame, self-doubt, we need to actually go back to the initial sensitizing event, and we do that via a bridge. Now, in the clinical resource therapy training, you will learn how to bridge back and work with traumatic or challenging or difficult materials. In the foundations training, we work with positive materials, because not everyone who does the training has experience as a therapist or as a trauma therapist. So obviously, if you're something like an EMDR therapist, you'll probably have done bridging before, or at least be familiar with the term or the concept. However, for the purpose of training today, we are using a happy memory, and we are vivifying the content part, and then we're going to do a bridge from the content part. So content,
Yes.
content, thank you. Content, I want to take us back now to like an earlier time when you felt this way, like when you, maybe even the first time you ever felt this way, this sort of nowhere to be, nothing to do, or just an earlier time in your life. So just connecting with that feeling that you described of like, like nothing to be, nowhere to go, that neutral comfort. You know, you've got the babies, one on your chest and one curled up, that just nothing's urgent, nothing's pressing on you, nothing matters. I'm going to invite you to open the mind up now and float back or bridge back in time to an earlier time, a significant time where you sort of felt this way, this content. Just let the mind drift back. Let me know where you land.
Does it need to be like the same kind of
just land
situation?
No.
Okay.
Just anywhere, even if it doesn't seem relevant, even if there's no details yet.
I have landed.
Okay. Are you inside or outside?
I'm outside.
Are you alone or with someone else?
With others, but they're kind of irrelevant.
Yeah. Tell me what's happening.
I am in the water at the beach on a gorgeous hot day, and I'm floating on my back in the water.
So it's gorgeous hot day, you're floating on your back in the water.
I could just feel how warm the sun is on my skin, and the water feels so refreshing but not freezing. And that block out of sound when you've got water over your ears, and the light glistening on the water is amazing, and there's no seaweed.
Is there any sort of smells and sounds?
Definitely some seagulls in the background, some beautiful bird song.
Bird song, yes, bird song.
If that's what we could call it.
Mm-hmm.
And then so no big waves, the water's fairly flat. So just really just floating there with no worry of getting dunked or anything. But hearing the little waves just washing on the beach, and hearing sort of people talking in the distance, and everything kind of far away but close at the same time.
Yeah, beautiful. And what are you feeling as you're lying there floating in the water?
It's very much that same feeling of just it's the feeling of no weight floating in the water.
Yeah, weightless, no weight floating in the water. Okay, and so this part of you that you're lying in the water, it's the most perfect, gorgeously hot day. What can I call this part of you? Is it still content, or is there another name that you prefer?
I think like relaxation.
Relaxation. Thank you, relaxation. That's my little bridge demonstration.
Oh, well, that was it. That was the end. Oh, because you want
I
to
already
keep going, but that's the example.
Yeah, you've now got a part called relaxation.
I have so many parts after today.